All right, now on to our big story. Tonight, we are answering as many of your COVID questions as we can because we know you have a lot during this latest surge. So let's start things off tonight with our own Pat Doris.
Let's get right to the questions. Judy says, I would love to know what the true COVID numbers might really be. My husband has tested positive, and I'm sure I have it too. Neither of us have gone in. He tested at work. So my question, how much higher might the numbers be given the shortage demand for testing and people just isolating without reporting? Excellent question, Judy. You know, I just checked the numbers and it's 8,672 is what the state's reporting, but your point is very well taken. The number is probably higher, probably much higher. In fact, the Oregon Health Authority director talked about that on Thursday during a news conference. Here's what he had to say about your question.
We've known throughout the pandemic that we don't identify every case that's out there. It's always been some kind of a percentage for a variety of reasons. People are asymptomatic, people are mildly symptomatic and don't test, or for whatever reason choose not to at different times, including right now it's been difficult to find a test. You know, we've probably done as well as finding perhaps 1 in 4, 1 in 3 cases. Right now we're doing not nearly that well. It could potentially be as much as few as 1 in 10 cases that we're actually being able to diagnose.
So hopefully that helps. 10 times higher it might be. That's a lot of people. Marlon wants to know, is COVID really as bad as you make it sound? The Omicron variant may be more transmissible but less virulent. Most are asymptomatic. You make it sound like everyone in the ICU is there because of Omicron. Well, I'm sorry if we do, we sure don't mean to. But it is an interesting question. So let's do a little bit of quick math, shall we? Yeah, okay, I think that'll work. Check this out. Imagine if under Delta you had 10,000 people infected and you knew that 1% of those were going to go into the ICU, okay? That'd be 100 people. Well, with Omicron, it's so much easily spread a bull. What if you had 100,000 people that were infected with Omicron and still just 1% went to the ICU? Well, that would be 1,000 people. And so that's what's going on here. A lot more people are getting infected, and the virus is having an easier time finding the people who cannot withstand it. And so more people are going to the hospital and then are ending up in the ICU. So we don't mean to say that everybody in the ICU has COVID. In fact, in Bend at St. Charles Hospital, I believe the number is 7 who have COVID and are in the ICU, and they have room for, I think, 30 in their ICU. But it's worth noting, of those 7, none are fully vaccinated. All right, Donna wants to know, if this new version Omicron is more like a bad cold, what's the big deal? I've not heard of anyone dying from it. Well, excellent question, Donna. And for a lot of people who are vaccinated and boosted, it is just like a bad cold. And that's a good thing. But for people who are not vaccinated, it's a lot more than a bad cold. Now, why don't you hear of people dying from it? Because in the hospital, I asked that very question, by the way, and they don't distinguish between Delta or Omicron. They just know somebody has COVID and that they're extremely sick and then they die. So that's why you don't hear XYZ number of people died from Omicron, because the hospitals don't know, and frankly, they don't care. They're just focused on taking care of those super sick people. Okay, I hope that helps. Keep those questions coming. We appreciate it.